Sticky, golden, unapologetically wild. Grindelia rises from the driest roadsides with a resinous glow and a lung-opening punch. This is the herb that catches the sun and clears the inner weather. Meet gumweed, small plant, big medicine. I recently asked our Ozark Mountain herbalists which Ozark plants don't get enough attention. Peter mentioned gumweed, suggesting it could be a potential substitute for endangered osha root. So let's take a closer look at Grindelia and bring it into the spotlight. Let's start by looking at the genus Grindelia. About 50 to 60 different species. Specific species are preferred or specifically noted for their medicinal properties, while many of them share similar characteristics due to the genus-wide resinous exudation. Some have been more extensively studied or traditionally used. Here are the more common medicinal species. Common medicinal properties across species. Many of them share common medicinal properties due to the presence of key phytochemicals like grindelic acid and other diterpenes, as well as flavonoids. They contribute effectiveness as expectorants, anti-inflammatories, and sedatives. The sticky resin found on the flower buds and stems is particularly rich in these healing compounds. This resin soothes irritation, clears mucus buildup, and supports smoother breathing. The genus as a whole is often used for bronchial problems, skin irritations, and as a stimulating expectorant. It has bronchospasmolytic activity, which is one reason it's also often called asthma reed. It was in the British Herbal Pharmacopoeia in 1983 listed for the specific indications of bronchial asthma with tachycardia, and the eclectics used it for asthma. So as far as the parts used, it's the aerial parts, especially the resinous buds and flowering tops. And here we can see the important constituents across species. And now let's look at pharmacological action. So it's described as an expectorant and antitussive, which means it helps to stop coughing, bronchodilator, and antispasmodic. It's especially useful for dry, irritable coughs, humid asthma, bronchitis, and allergy-related lower airway spasms. It's also anti-inflammatory and antioxidant. Grindelia extracts inhibit inflammatory mediators and show notable antioxidant activity. It has immunomodulatory and anti-infective effects. As far as traditional and clinical uses, acute and chronic bronchitis, spasmodic or asthmatic breathing, emphysema-associated cough, and hay fever. It can be used topically for dermatitis, poison ivy, poison oak, insect bites, minor wounds, and irritated mucosa. The resin forms a protective, mildly antimicrobial, and vulnerary layer. Historical eclectic use emphasized asthmatic breathing with a sense of fullness in the chest and difficult respiration, often as a specific indication for the tincture preparations. As far as respiratory indications and pattern, think of it as an adjunct for spasmodic, obstructive, stuck mucus respiratory pictures, typically in low, moderate tincture doses alongside standard inhaled therapies if they're used. There aren't any documented pharmacokinetic interactions with inhaled corticosteroids or leukotriene antagonists, but clear potential for additive anti-inflammatory effects. It can be used topically, mainly for allergic and irritant dermatitis, especially poison ivy, poison oak, insect bites, minor wounds. The resinous constituents form a protective, mildly antimicrobial and anti-inflammatory layer that reduces it and speeds up re-epithelialization. Main dermatologic indications, think of it for allergic contact dermatitis, minor skin trauma. Now let's find out how to use it. Look over on the left-hand side of the screen for preparation and dose. We see that we can make a tincture. The flower buds are extracted in 65 to 75% ethyl alcohol. That would be 1 part buds to 3 parts of the aqueous alcohol. 1 dose, if you're using low doses, I always recommend people start with low doses. Drops are just fine for a lot of tinctures. Here we see 5 drops under the tongue. Or you could add the tincture to a hot steeped yarrow tea for coughs, colds, and flu. Another recommendation is to use the dried leaf. That would be a 1 to 5 weight to volume ratio in 70% alcohol, or the fresh unopened flower buds. That would be a 1 to 2 in 95% alcohol. And here the recommendation is 1 to 3 milliliters, 2 to 4 times daily, or 5 drops every 15 to 30 minutes for a coughing fit. Here's tincture doses for adults. Here are dose ranges. You can also make an infusion. Boil 1 cup water and soak 1 teaspoon of the dried herb in the water. Drink the infusion 3 times a day. Here are instructions for topical preparations and application methods. You can make an oil with it. And here are specifics to make a treatment for poison ivy. And here is your core extraction strategy. Use an alcohol intermediary infused oil to capture the resins. Then build salves and creams from that oil. The typical approach is to lightly moisten chopped flowers and buds with high-proof ethanol, macerate 12 to 24 hours, then cover with oil, and warm infuse before straining. For a resin-rich Grindelia, most herbalists use long room temperature maceration in high-proof alcohol or oil for 4 to 8 weeks, with 6 weeks being a common minimum. Longer alcohol macerations up to several months are sometimes used when only lower proof alcohol is available. And here's some other approaches you can take: an alcohol tincture, oil infusions for topical use, and then you can use honey. I made a great honey extraction when I lived where we had a lot of gumweed. And then here you can see what are the best carrier oils. For Grindelia salves, the best carriers are stable, moderately heavy oils that hold resins well and match the intended skin presentation. The primary carrier choices are going to be olive oil and sunflower or sweet almond. When to blend oils. For stubborn, localized rashes and bites, adding a small proportion of castor oil or coconut to an olive-based infusion increases the stickiness and occlusiveness, and that's helpful for keeping the Grindelia in place. For facial or acne-prone skin, combining a small amount of Grindelia olive infusion with some low comedogenic oils like jojoba or sunflower can reduce the heaviness while preserving resin content. So prioritize oils with good oxidative stability to match the long maceration time typical for Grindelia. Skin feel suited to the indication, heavier and more occlusive for weeping, itchy dermatitis, lighter for chronic irritated but non-oozing skin. Many herbalists default to olive-based Grindelia infusion for general first aid salves, then adjust texture and absorbency by blending in 10 to 30% of a lighter or more occlusive oil. for preserving the resin. You see some recommendations for the oils that provide the most protective carriers. And here is when to limit other oils, practical formulation strategies here. You can come into the database and dig into all of these different approaches. Let's check out the cautions. On the left-hand side, you can see cautions, and we find that it can be toxic in large doses. It's not for long-term use or for use by people suffering from kidney or heart disease. Prolonged use can cause irritation in the stomach or kidney. It's best used in occasional, small doses and in combination with other herbs. As far as topical use, it's possible that there could be transient burning or stinging, especially when alcohol-based products are applied to broken or very inflamed skin. There can occasionally be some contact dermatitis. People who are allergic to plants in the Asteraceae family, of which this is a member, need to do some patch testing on a small area to find out if they're going to be sensitive to it. Which species live in Arkansas? Let's go back to the genus and look for plants that have a green check mark on them. All of the plants that grow in Arkansas will have a green colored check mark. So here's one. We have curly top gumweed, and we have golden weed. We also have narrow-leafed gumweed, also called Texan gumweed. If you're using the database to investigate gumweed, I recommend that you spend some time on narrow-leaf gumweed because there's a lot of additional information here. We see, that, of course, the qualities and properties, pungent taste, followed by some bitterness, cooling and moistening. There's a lot on the constituents. We have the key anti-inflammatory compounds, the resinous ones, the polyphenols and phenolic acids, and then there's some synergistic interactions listed here. I'm going to scroll down through all of this. Here are the pharmacological properties, and there's a lot more on the medicinal properties. For example, it's excellent for treating the lingering dry cough that can last for months after a cold. And here it says it can be thought of as a substitute for OSHA. Herbalist Ellen Zimmerman says OSHA is most appropriate for a wet, boggy lung condition, while Grindelia will really get at that dry, unproductive cough when a person is unable to cough up any phlegm. In tachycardia, it helps slow down a rapid heartbeat, including a nervous rapid heartbeat, and can be useful for palpitations too. It's hypotensive, it lowers blood pressure, but should be used with caution under the care of a qualified herbalist or other healthcare professional for those with a weak or damaged heart. Well, we've already seen that as one of the cautions. I'm going to skip through some of this. One of the more interesting uses that was pointed out by Matthew Wood and how he uses it, he recommends it for sleep apnea. Now there's one more thing I want to show you. If you cannot find gumweed, there is a cough syrup, a commercial cough syrup called Grintus that uses it. And you can click on this link and find out where to buy it.